A warning from child safety advocates tonight. They say the Trump administration is slashing a program to protect babies. For nearly 30 years, the Safe to Sleep campaign has educated parents to prevent sudden infant death syndrome, cutting SIDS deaths by more than half. But now the Department of Health and Human Services has fired the program staff. 2 Wants to Know's Ben Briscoe is looking into the impact of these cuts.
Even after 27 years, the pain doesn't go away.
I must have started screaming because everybody came running to my office.
Allison Jacobson was at work when her child's daycare called and said there was something wrong with Connor. She rushed to the hospital.
I kept just praying, let Connor be okay, take me, whatever. And I got to the emergency room and I walked in and I saw my husband. All he said is, "Connor's with God." And I fell to the ground, and I think I passed out.
After her 3-month-old died from sudden infant death syndrome, Allison poured her grief into action with the nonprofit First Candle, educating other parents about the danger of babies sleeping in the wrong positions. For more than 2 decades, the group worked closely with Health and Human Services' Safe to Sleep program, until last week, when they got this email saying HHS terminated the entire office. With that comes the leadership of and the involvement in the Safe to Sleep campaign.
It is beyond me for a government that says they care about babies and they care so much about children to cut a program whose sole mission was to save babies' lives. And I know that without this program, there are going to be more deaths.
Across the country, SIDS deaths have dropped 55% since the Safe to Sleep campaign started in 1994. That's more than 1,500 children saved every year. But in North Carolina, there were still 135 babies in 2022 that died in their sleep, including in Guilford and Forsyth counties. While the national Safe to Sleep is being cut, a smaller program is currently funded by the state. Those advocates say losing the national program will hurt.
It's a huge loss. It really is kind of the North Star for all of us who are doing local work to try to find out the best way to promote these good recommendations for safe sleep.
The national program also provided printed information that parents could take home from the doctor's office. Campaign materials are still online to download, but if local groups try to order copies, the website says they are currently unavailable.
If you've ever been in a doctor's appointment when you might receive this information, you're getting a lot of information. So receiving that handout, something that you can bring home, something that parent can share with other folks who are watching that baby, that's really important to have something tangible.
Just devastating for me when I think about my son who died. And I talk to parents who are in our bereavement support groups who say, "I didn't know. No one ever told me." That is heartbreaking.
I reached out to the Health and Human Services to find out why cuts were made to this program. The agency sent this response. Safe to Sleep campaign materials and tools remain available to the public. No final decision has been made regarding the future of the Safe to Sleep campaign. But again, for right now, the program's leaders and staff have been fired as part of the Trump administration's sweeping budget cuts.